TB is a single leading killer from any infectious agent on this planet. And, the death rate from TB, the number of preventable deaths that have occurred from tuberculosis in the time that we've been seeing a pandemic of COVID, that number of deaths is orders of magnitude higher than the number of people who've died from COVID. We learned a lot from TB. We learned where TB explodes in terms of outbreaks, and that is in people who are homeless. Unfortunately, I've heard too many stories of people thinking, okay, right, homeless person, got a cough, lost some weight, got night sweats, COVID negative, discharge. People just don't include TB as a differential diagnosis, whereas for us it's, you're TB until proven otherwise. So we take a nurse and a peer to actually test people on site where they are, clinically assess them, escalate them if needed, taking a service to people to actually try and make sure that we can get an early diagnosis. We screen about 10,000 people a year normally. TB is an airborne disease, and if they're at increased risk of TB, they're at increased risk of COVID. We've been opportunistically identifying quite a lot of cases from COVID. TB's there, it never went away. And even on conservative parameters, nationally, we prevented probably hundreds of deaths and many, many more infections. It is a public health issue. It is in all our interest. It is completely within our grasp to redouble our efforts to find social and technological solutions to TB. We can do it for COVID, we can do it for TB.
QIAGEN.
Sample to insight.